All right. Thank you so much. It's such an honor to be here today. I'm going to be speaking to you about One Health, giving some introductory remarks. A lot of great panelists coming right after me. But first, I want to tell you about a turning point in my career. For nearly a decade, I worked for the US Centers for Disease Control and Prevention, fighting outbreaks around the world. In 2014, CDC sent me to Liberia to help fight the largest outbreak of Ebola ever. There's a reason movies are made about Ebola. If you contract it, you have a 50-50 shot at survival, and the unlucky half will die in unimaginable agony with multiple organ failure and extensive bleeding. It gets worse though. The virus sets a diabolical trap. The sicker you get, the more hands-on care you require, which means that you're more likely to pass the virus on to other people. Without adequate equipment, infection control becomes nearly impossible. And tragically, in Liberia, there wasn't much of that. This was the only Ebola care center in Bomi County, located hours from the nearest city. I was deployed there to support the government response in doing infection control and contact tracing. Staff had 2 computers for the entire county, which was an area larger than all of Paris. Some evenings, healthcare workers would run out of gloves overnight, leaving none for the morning shift to take care of Ebola patients. This right here was the regional ambulance. In the back of that pickup truck, mortally ill patients would be transported over miles of dirt road under terrible conditions. In fact, right here, you can see a mother and her infant in the back of that pickup truck after having just arrived from one county over. Both of them had Ebola. Imagine the terrors that they endured. Stifling heat, no air circulation under that plastic tarp in which they were transported, miles of dirt road, and the uncertainty of their future. The baby died the next morning. Under these circumstances, it's no surprise that healthcare workers, often working for long stretches of time without pay, were among those at greatest risk for getting Ebola. I'll never forget my conversation with a man who sacrificed everything to take care of his fellow citizens. He begged me to help him get evacuated to the United States after he got Ebola. But I did not have the power to grant him his wish, and he died praying for a miracle that would never happen. It's possible that this epidemic began with an axe. Communities in neighboring Guinea had no choice but to clear forests to make way for farms. But those forests were previously home to bats, some of which can carry viruses that can infect us. And as they lost their habitat, some of those bats moved into villages. Then in 2013, a 2-year-old boy died of Ebola, making him the first patient in an epidemic that would go on to kill 11,000 people. Some epidemiologists believe that this boy acquired Ebola from bats living in a hollow tree where he had been playing. If so, it would not be that unusual. Viruses are constantly jumping from animals to people. In my field, we call that spillover. And in fact, a majority of new infectious diseases and most, if not all, pandemics since 1918 have been caused by pathogens that jump from animals into people. And there are thousands upon thousands of other yet-to-be-discovered viruses circulating in wildlife right now that could one day also make the leap. We continue to create conditions that make this leap more possible with each passing day. Let me explain. First, there's habitat destruction. Our extraction of resources around the world has led to the destruction of ecosystems, erasing the boundaries between animals and people, creating opportunities for spillovers. Then, there are industrial farming facilities, where thousands of inbred animals literally sit around in their own feces awaiting their death. These are like factory-sized petri dishes. Meanwhile, commercial wildlife trade to meet the demand for exciting foods and luxury pets is moving pathogens around the world. And in the backdrop of all of this is climate change, which is fundamentally altering transmission dynamics. Over half of known infectious diseases have already been aggravated by climate change at some point. When you do this type of work, you quickly realize that emerging infectious diseases are the great equalizer. In 2019, I deployed to the Democratic Republic of the Congo to support the government response to the second largest Ebola outbreak ever. I was shocked when I was at a local hospital one day to find healthcare workers washing and reusing masks, like you can see here, because there were not enough to go around. A few months later, the COVID-19 pandemic occurred. During that awful first wave, one of my closest friends from my medical training asked me if I had extra masks to spare because the hospital where she was working had run out. This was in New York City. It was a reminder that at the end of the day, we are all the same to viruses. Believe it or not, my goal today is not to terrify you. Rather, I'm trying to make the point that all fortunes on this planet are intertwined. As our planet's web of life unravels, there are complex and often unpredictable consequences for humanity. This is the premise behind a growing school of thought known as One Health. Indigenous and traditional cultures around the world have understood this relationship between human well-being and environmental well-being for eons. But in the West, we're only beginning to grapple with the idea. Spillover is one manifestation, but there are thousands of other examples. I'm going to give you one that shows the unintended consequences that our actions can sometimes have. In the 1990s, the patent on a common painkiller called diclofenac expired. Shortly thereafter, generic versions of this drug flooded the market, and farmers across India began feeding it to cattle to cure common ailments like injured joints and inflamed udders. Unfortunately, fate is cruel, and sometimes these cattle succumb to their ailments. Enter vultures. These scavengers make quick work of remains, cleaning up messes before they are allowed to fester. These birds can digest just about anything except for diclofenac. The drug triggers fatal kidney failure in vultures. So as the birds started eating dead cows whose tissues were saturated with diclofenac, the vultures started dying. And over the next decade, the subcontinent's vulture population plummeted from 50 million to just a couple thousand. But without vultures, cow carcasses began to pile up. And because of that piling up of cow carcasses, feral dog populations began to grow, spreading diseases like rabies. Some of those cow carcasses ended up in rivers, which you can imagine is really bad for water quality. And meanwhile, toxic chemicals used to clean up some of those cow remains also started leaching into the waterways. All of this had an impact on human health. It's estimated that because of this drug-induced nightmare and its knock-on effects for human health, there were an estimated excess of 500,000 human deaths over the next 5 years. That's One Health in action. But we don't teach these things in medical school. Future doctors are not learning about rainforests and agricultural policy. They're certainly not talking about vultures, and it shows. In 2020, the World Health Organization convened an expert panel charged with figuring out how to make COVID the last pandemic. In their 86-page report, there were 2 mentions of the word wildlife and 1 mention each of the words deforestation and climate change. This is a shame because with a One Health approach, we can prevent some pandemics before they even start. Doing so requires first and foremost that we protect what's remaining of the world's last rainforests. But I'm not going to belabor this point. We all know that it's important to protect rainforests, yet society has chosen not to do so. But let me leave you with 3 solutions available at our fingertips today that would make a massive impact. The first is is addressing, the first is investing in a robust veterinary workforce. Cramped facilities have become common around the world, but these are like tinderboxes for the next pandemic. When one animal invariably falls ill, pathogens rampage throughout the brood, picking up new mutations along the way. Now, it breaks my heart to admit this, but we are not going to end industrial farming anytime soon. But until then, investments in animal health care need to keep pace, both for the sake of animals and for ourselves. The second is a complete and total ban on fur farming beginning here in the European Union. Caging wild species like raccoon dogs and foxes is a unique threat to people. Let's take mink. These are like viral sponges. They can contract viruses from people, incubate them, then pass them back to us in mutated form. In 2020, hundreds of people in Denmark became infected with mink-related coronavirus strains, prompting the killing of 17 million mink. The Danish government then responded by banning mink farming, but only temporarily. Let me be clear, there is no reason why we should be taking wild animals and putting them into small cages only to be gassed or electrocuted so that we can rip off their fur to make fashion. Doing so is a very severe threat to our health in addition to the animal abuse. It's long past time that we phase this industry out. The EU is considering doing so, and the rest of the world should follow. My third and final recommendation, crack down on the wildlife trade more broadly. In 2003, the first ever outbreak of Mpox occurred in the United States related to the importation of African rodents for the pet trade. The year before that, SARS had emerged, ultimately infecting over 8,000 people in nearly 30 countries. SARS originated in animal markets selling live wildlife. Nearly 2 decades later, those same type of live animal markets very likely triggered the COVID pandemic that upended the world order and killed millions of people. It does not make sense to sell live wild birds and mammals in the streets of Wuhan, New York, or Paris. Doing so is like conducting a dangerous genetic experiment in the heart of the world's largest population centers. We need to ban the sale of live wild birds and mammals in urban centers now. But we must also recognize that science and policy alone are not going to save us from ourselves. What we need in addition is a radical reimagination of our future. We need to build a new culture of care. And here, the example of prior nonviolent revolutions is illustrative. They show that it takes just 3.5% of the population getting involved. Exceed that threshold and toppling unjust regimes becomes virtually assured. This means that the revolution that is so urgently needed will begin with millions of ordinary people engaging in everyday acts of humility, like recognizing that we are not the masters of this planet, and that we are not a species that sits above all others. This is not a radical idea. Everyone knows that all life, when we are born, we all know that all life is worthy of love. As kids, we rescue kittens and we take care of injured birds. We keep pet spiders and cry when they die. Our greatest test, the one that will decide our fate as a species, is whether we can reclaim that feeling. Thank you.